Hi, Mr. Parcell. How are you doing today?
I'm doing well. How are you?
I'm well. My name is Alicia, and I'm going to be your nurse. Is that all right with you?
Yes.
Okay, good. All right. Well, I've spoken with your doctor, and it seems as though we're going to be doing 3 injections today. I've already gathered all of the supplies and checked it 3 times against the medical administration record and verified the doctor's orders, your medications. I just need to check one thing here. Is your name Daniel Curtis Parcell?
Yes.
And is your birthday 9/16/1983?
Yes.
Okay. All right, wonderful. Well, we'll be starting with an intradermal injection, and that is going to be a tuberculin test for you. And I'm going to be instilling 0.5 milliliters of the solution in a 26 millimeter with a 26 millimeter needle, and it's going to be about 1/6 of an inch in width. And then I will be doing a subcutaneous injection, and that's going to be with a 25 millimeter needle, and it is about 1/2 inch in width, and I'll be instilling 1 milliliter this time. And then the intramuscular, which is going to be a little bit deeper than the other 2, it might pinch a little bit. That one is going to be with a 25 millimeter needle, and it's going to be 1.5 inches in width. We're only going to do 1 milliliter today on that one. Okay? All right. I'm going to start off with some hand sanitizer here and get my hand hygiene done. Oh, so how's school going?
Excellent.
Good. You gotten that master's yet?
Close.
Oh, wonderful. Got any big plans afterwards?
Start a business.
That is a good idea. What kind of business are you thinking?
IT.
IT. Anything in particular, or can you not tell me?
It's a hush-hush.
Hush-hush ordeal. I hear ya. Okay. All right. Well, if you don't mind extending your right arm here for me. Okay. And underarm up. Okay. And you can just rest it here for a second. I'll have you lift it here in just a moment. Okay. I'm going to go ahead and clean off the top of my bottle. My alcohol prep pad. And then I'm going to draw up the 0.5 milliliters. I'm just going to leave that position there. Then I'm going to get another alcohol prep pad and go ahead and prep the site. Now, Mr. Parcell, after all of these injections, you are not going to want to rub or scratch them, okay?
Okay.
And right now, I'm just cleansing the area to be used in a circular motion starting from the inside out. Okay, are we ready to go?
Yep.
Okay. Now, I'm going to be inserting this needle between a 5 and 15 degree angle. I'm just going to go just underneath the skin, bevel side up, okay?
Okay.
Now, don't worry if you see a wheal appear. That just means that some of the medication has collected underneath the skin and is popping up, and we will handle that if we need to, okay?
Okay.
Okay, wonderful. Leave that there for just a second. Now, for educational purposes and safety, I've recapped my needle. With the skin taut, I'm coming in bevel side up at a 5 degree angle. I go in just until the bevel is covered. Then I release the skin, come up and secure the needle, my non-dominant hand, and slowly, over about, say 5 seconds, inject the medication. Then I'm going to pull the needle out at the same angle that I put it in at. Quickly take a cotton pad and cover the site. And no medication or blood is seeping out after adding pressure. So I'm going to go ahead and remove that pad. It doesn't need a bandage, and no wheal has appeared. Again, do not scratch or itch that, okay?
Okay.
All right. Now, are you ready for your insulin shot?
I am.
Okay. All right, I'm going to go ahead and prepare that. Go ahead and clean the top of your insulin here. Looks good. And today you are going to be getting 60 units of insulin. I'm going to invert the bottle. Drop 60 units. Checking that there aren't any bubbles again. Here we are. Okay. We'll leave that there for a second. Do you mind rolling up your sleeve, Mr. Parcell? Scoot forward for me. Okay, I'm going to be using this subcutaneous layer right here because we've got a lot of muscle up here. Okay. So again, I'm cleaning the skin from the inside outside in a circular motion, making sure that I get it all cleaned and disinfected. Now, I'm not going to be using a Z-Track method today because this isn't an irritant medication. Okay. All right. Can you lift your arm up a little bit so I can see it here in the light?
Cap that.
Thank you. And again, as my needle is capped, for safety's purposes, I'm going to come up to the area I've just cleaned, spread the skin taut, come in at a 45 to 90 degree angle, bevel side up, and slowly insert my needle. Then I am going to, over about, I'm going to say 10 to 15 seconds, inject the medication into the subcutaneous layer. Then I apologize. I would have actually come up, because I'm not doing the Z-Track method, so I wouldn't have had to continue to hold and stabilize the needle as I did that. So I would then slowly inject over about 15 seconds, and just so it doesn't move out of place, into the subcutaneous layer, and then I would release my hold and pull the needle out at the same angle that I took it in at. Quickly come with a cotton pad and hold it in place. And how do you feel, Mr. Parcell?
I feel good.
Okay. Now, don't scratch or itch at this, and we don't have any blood or medication leaking out, so we're doing good. All right, we have one more injection today. So for the intramuscular, we are going to be using the Z-Track method, and this is in order to ensure that none of the irritating medication leaks out. And we're going to be doing about a milliliter today. Alright, I'm going to go ahead and prep the area. You don't mind coming forward for me? Okay, got my alcohol prep pad all ready to go. I'm going to locate the cricoid process. I'm going to come 3 fingers down from it in the middle of the arm. Then I'm going to shape out the deltoid muscle with a V shape in my fingers. Then I'm going to take the skin and pull it down and taunt so that it's about an inch lower than it originally was. I'm going to clean it in a circular motion, moving outward. And 1 milliliter to 2 milliliters is fine in the arm. Okay, so my area is cleaned. It's pulled down about an inch. 3 fingers beneath the cricoid process. So this time I'm going to be coming in at a 90-degree angle, bevel side up, so I can see where I'm going in at. And you're just going to want to pierce the skin quickly. And then you are going to want to, keeping it taut the whole time, come up with your fingers, keeping it pulled down, and stabilize your needle. And then you're going to want to inject your medication slowly over 10 seconds. Then, before releasing the skin, you're going to want to remove the needle at the same angle that you put it in at. Then release the skin up. That way, that's the Z-track method, so that it can't come out and irritate the outer skin. It's down in the muscle and it's staying there. There's no pathway of exit. I'm going to hold this here for a moment. We don't have any blood or medication leaking out, thank goodness. How do you feel again, Mr. Parcell?
I feel good.
Good. No pain, no discomfort, nothing like that?
Nope.
Okay. Again, do not scratch or rub any of the injection sites, okay?
Okay.
Okay. Go ahead and take off my gloves. If you have any pain or anything, you just let us know, okay? Then I would pick up my supplies, remove them, throw them away, and come back, and the doctor will see you shortly, Mr. Parcell.
Okay, thank you.
You're welcome.